sort of interactive books for the iPad, made specifically for the iPad, and becoming really popular in hospitals and universities. So I thought a good place to start is all the way back with Leonardo Da Vinci, and he's creating these amazing anatomical studies just using traditional media. So he's using paints and pastels and charcoal, and things remained pretty much unchanged for centuries. And even when I first started my career, I was using just acrylic paints and pencils to create these illustrations. This is a polycystic kidney, which it looks quite strange, but it's a kidney that's become diseased and is filled up with all these horrible cysts, and actually causes the kidney to expand to 4 or 5 times the size of its normal size. This is an illustration of a hand dissection. So we've removed all of the skin just to show the palmar aponeurosis, which is this white fibrous layer that covers the palm of the hand. And has these very distinctive bands that come up like this. But the purpose of illustration is to make this clear. So if you were to take a picture of this in real life, it's very difficult to see all the different structures and things. Yeah, this is another illustration from the same series. It was actually for a plastic surgeon that wanted to create a sort of reference book for his students, so that when they're watching the surgery or having a lesson, they can just refer to these and understand the anatomy a bit easier. So this is all the nerves in yellow and the arteries in red, and it shows how they pass underneath that layer, that aponeurosis. So then computers started to develop and become more affordable, and they started to find their way into medical illustration. So now this is using Adobe Illustrator and Photoshop, and this is really now the most popular way of creating illustrations for publishers, which has positives and negatives, because the positives are they print really well because of vector illustrations, and the downside is because everyone's using the same programs, they tend to look very similar. So some of the art is taken away in a lot of ways. But it's much more commercial to use this kind of style. So. And then as computers have really progressed and become really more powerful and cheaper, we're now at the stage where freelance artists can essentially create their own animation studio, which 15, 20 years ago would have been impossible. So this was some of the 3D illustrations that I've been working on. So this is a skull, obviously, and I've used all kinds of reference from like books and through to real skulls, and I was really just trying to get as much detail as possible. Yeah. Oh, sorry. Yeah. Hello. Is that actually on? Yeah. But yeah, basically, I was trying to get it as detailed as I possibly could and as accurate as I possibly could as well. So with the skeleton, every tiny little hole and bump and notch and groove is all there for a reason. You can't just make it all up. It's all there for a reason. So this is a femur, and this is like the upper leg bone. And to create this one, I actually used a CT reconstruction as a guide, and then I could model it in Blender to create a very accurate form, basically, of the femur. I then took it into ZBrush to sculpt all the finer details and do all the texturing. This is the cervical spine, which is the very top of the spine. So your skull would sit right on top of this. And with this, I was actually experimenting with a feature called Spotlight in ZBrush, which is where you can actually map photographic textures onto the model very easily to create quite a nice realistic look. This is the same model but from a slightly different angle, and this was rendered in Blender, and with this one I tried to add some displacement just to give it a little bit more texture, and you can see the arteries that run right up the side of the cervical spine, and then they loop round and then back into the skull. This is one of the earlier projects I was working on. I actually created the whole skeleton, every single bone, and then I thought I would try building all of the major muscles of the body onto the skeleton. This is all modelled in Blender, and then I take it into ZBrush and do all the colouring and the details. Yeah, and this was about as far as I managed to get with the model. So it is most of the major muscles from the waist up, apart from the face, which I'm still working on. But when I started this, I was really quite new to ZBrush, so I didn't really understand how to create the displacement maps and things. So I just made really dense, heavy models to sculpt all the details. So at this stage now, the poly count is so high that I can't really add any more, any more muscles. So this is obviously an eyeball, but again, this was just experimenting with a program called Octane, and I created the eyeball in Blender just as very simple, 3 simple shapes, and then mapped the iris, the colour part of the eye, onto the model, and then wrapped this transparent sphere around the whole thing to give it a transparent, shiny look. So this is a hip replacement, and 3D is very good for showing how the components of implants actually all fit together, and you can show the actual thing in situ and working. Another area that we work with is medical instruments, and 3D makes this so simple. Back in the early days when we were trying to draw this with pens, it was just so difficult to get all these curves and straight lines, and the actual metallic finish that 3D can do so easily is very difficult to do in 2D. This is a similar one, but this is a tracheal dilator. So this is used in surgery to open the neck. So this is a pretty standard generic sort of illustration that we create for patient information. So when we're trying to explain to patients the anatomy that is involved before they go for a surgery, we can show them illustrations like this, and they see it, you know, more easily. So it's easier for the nurse to explain the procedure. This is a model of the bronchial tree, so it's the lungs. And for this one, I was experimenting with the 3D reconstruction at the time. So as well as bones and things that we can reconstruct, we can also reconstruct the bronchial tree. So I use that as a guide, and then create a nice clean topology, which I can then sculpt in ZBrush. This was taking it one step further, so this is creating all the tiny blood vessels that are in the lungs, and all the tiny bronchial tubes and things. And this was actually surprisingly easy to make as well, this quite complicated mesh. There's a feature in Blender called the tree script, so it's actually for making trees, but it's such a similar structure that it really works quite well. It only took about an hour or something like that to create that much detail. So this next stage is the 3D reconstruction. So this is an example of a still CT, so just one CT image. when a patient has a CT scan, the scanner will create lots and lots of slices like this all along the body. And we can then process all of those in the computer to create very detailed images of the patient's anatomy. So this is a real person. And if you look in the corner of the armpit there's like a red lump, and that's most likely the reason why they had this CT scan. So this is probably a tumour. But the amazing thing we can do with these CT scans is separate all of the anatomy. So we can have the skin as a separate layer, the muscles as a separate layer, the blood vessels, and then the bones underneath as a completely separate layer. And then we can make areas transparent so we can actually see the anatomy underneath. So this is with all of the soft tissue removed. So this is just the skeleton. And you can see how much detail the actual scan picks up. If you look in the hands here, we have these tiny little bones here. And these are called the Sesamoid Bones. And it even picks those up, which are tiny, tiny little bones. So it's a huge amount of detail. This is a slightly strange looking one, but this is with the all of the skeleton, but with just some of the blood vessels, major arteries, basically. So you can take this into ZBrush and start to paint on the colour onto the arteries to separate it from the bone. This is still a work in progress, so you can still see some of the arteries that still need to be coloured. Yeah. This one just shows how you can actually slice away some of those layers because they're all separate. And then underneath you can see it doesn't construct muscle too fantastically, but you can still use that as a guide. So you can, if you wanted to make the muscles of the upper limb, you can use this as a very rough guide to make sure that the anatomy is in the right place. So underneath here you can see this is a large muscle that comes up, and it's called the sternocleidomastoid, I think, something like that. And then this is the edge of the deltoid and the pectoralis muscle. That's the clavicle coming down. Yeah, this one's just a very detailed render of the teeth, basically. And I put this one in just so you can see how, by making it semi-transparent, you can actually see the tissue depth from the skin down to the bone, which can be really useful for creating illustrations. Yeah, again, the reconstruction of the muscles is not that great usually, but sometimes you can get quite good results. So this is actually showing all of the major muscles of the lower limb, and you can even see the serrations in the muscle, so all that texture. This one is a reconstruction of an aneurysm. So this is the white part underneath. This is the base of the skull, and then the red area is the blood vessels of the brain. So the carotid arteries are coming into the base of the skull, and then they bend around like this, and then they form a network of blood vessels called the circle of Willis. And this is a very common area where you get these aneurysms. The aneurysm is obviously this huge bulge in the middle. This is quite a large aneurysm, this one. But by reconstructing it in 3D, the surgeon can actually take a look at the patient's condition before he actually does the surgery. So it gives him a very good view of the anatomy before he actually goes in and operates. This is another aneurysm, but from a different viewpoint. So we've cut away part of the skull so that you can actually see the two vertebral arteries coming in through the base of the skull. This hole at the bottom is where the spinal cord passes through. But these two vertebral arteries also come in, and then they merge and form this network of blood vessels. This is a very close-up view of the aneurysm. So it's this small bump here, and that's a very common place to get the aneurysm. Again, this is even closer. This is looking from the front of the skull, just with half of the skull removed, and just for a different viewpoint. And that's looking from above. So this is just a couple of examples of how we're actually using them. So this was created for a doctor that wanted to present this case where the patient has a tumour in the side of the face. So we were able to make the reconstruction and then use it for a poster presentation she was doing. This is a hyroid bone, which is a bone that sits in your throat, and it's very important for speech because it has all sorts of muscles attaching to it. And this was done for a speech therapist who was presenting a particular case and wanted to show how this was fractured in the patient's neck. So this is just a couple of little case studies. This is quite a severe one. So, but basically, this is a patient that fell onto an iron bar, and the iron bar has gone straight through the skull into the brain. And this was for a presentation that the surgeon who wanted to show how they removed the iron bar, basically. So the patient was fine, survived, no brain damage, nothing. Incredible, really. So what we created for them was an animation showing the iron bar in the skull. So we created a 3D reconstruction from the CT scan that the patient had after the surgery, so we could see the hole. And then we created a fake digital iron bar using this as a guide for the shape and size. And then we were able to position that in Blender using the X-rays as a guide, as background images, to align everything so we can show the angle and the depth of the bar in the person's skull. This is just a quick animation of that. Hopefully it'll work. So you can see a huge iron bar. This second one is, again, a doctor wanting to show how he's fixed this patient's injuries. This patient had quite a large trauma to the side of the face, and you can see all of the fractures in the skull, all the bones kind of separating and coming apart. And on the close-up, you can actually see the base of the orbit. Some of the bones are actually sticking up, so they have to push all this back into place. And then they have to fix it all with titanium plates. So we created a 3D reconstruction before the surgery, and then a 3D reconstruction after the surgery. So this was the before, and this is the after. So all these grey areas are the titanium plates, but these have been coloured in ZBrush just to highlight them, basically. The white areas of the orbit, these are actually titanium plates as well, just holding everything down. And these strange sort of metal blobs coming over here, these are actually staples from where they've had to fix the incision that they've had to make to gain access to the face. This is just a quick rotation in ZBrush to give you a better idea of the anatomy. So although the reconstructions can be quite noisy and messy, you can use those as a brilliant guide for making very anatomically correct models. Have I actually gone over now? Or have I still got time? I can't tell. I wanted to show you these Ibooks anyway, so I'll just plug it in. So iBooks are these interactive books that are designed specifically for the iPad. It's a free piece of software. If you use Macs, you can download this for free and create these iBooks very easily. So we've been creating these for the hospital. So when a patient comes in for surgery, we can show them these iBooks, and it demonstrates the procedure to them so that they can make informed decisions about their treatment options. So we can have these interactive diagrams, so you can pull these out, make them go full screen. Then you can add these labels, and you click the label and it'll zoom in and tell you more about it. It's a really nice program to use, very, very simple to put together. You can drop animations in, so you can have them playing full screen. I won't play the whole thing because it takes a while. And then you can just have it all split into chapters, and you can just put anything you want in there. Really fantastic program. I'll just quickly show you this other one. So yeah, you can pinch with 2 fingers, and this will bring it down to this level where you can see all the individual chapters. These little dots at the bottom are all individual chapters, and you can see exactly what's in each chapter just by clicking on it. And then you can just scroll through as if it's a book. I'm not sure what's happening there. But there it goes. Yeah, you can also have these collider files, so you can drop these in and then have models that the patient can actually rotate themselves on the screen, and the nurse can actually use this to demonstrate the anatomy as well, and you can use your fingers to really go in close. So if anyone uses Macs, it's a good one to play with anyway. So. And that's the end, I think. Yeah. The software to make the actual reconstructions is free, but they only make it for the Apple, so it's an Apple program. It's called a Xyrix. Yeah, it's quite easy to use as well. Actually, they have a few data sets as well that you can play with on the website. Yeah, really good.